What is self-management? Self-management, the dictionary definition is management of or by oneself, the taking of responsibility for one's own behaviour and well-being. And I've got a patient's definition here of what self-management is as well. So self-management is, self-monitoring is about knowing how to recognise the difficulties MS can bring and adjusting your way of life to accommodate them, finding new ways to live life to the full. So what is self-management? We do it all the time. We're doing it on a daily basis, but we just don't realise we're doing it. Every time we get in the car, every time we get kids ready to go anywhere, everything in life you're self-managing. So we're really looking at it from an MS point of view here. So MS is unpredictable. So how you manage an unpredictable condition, it's difficult. It's giving you strategies. And as I go through the slides, you'll see different strategies that are available and help for you, apps and things that are there to help you face these challenges and manage them. So when you look at self-management, on average, there are estimated 100,000 people living with MS in the UK, and the average time you would spend with a health professional is about 3 hours in that year. And when you look at this pie chart, it's a tiny wee part of your life, and we're asking you to manage the rest. You need to look at how you're going to manage the rest of that. And these 3 hours is where we have quality time with you to empower you to manage the rest of that. So when you look at that tiny wee line, that's the impact we have on your lives, and you're left to do that. So we need to empower you to have the strategies and the knowledge and know where to source things to help you manage your MS. So when knowledge is power and managing your MS, every one of you are like that fingerprint up there. You're all unique in your own condition. You're unique in your journey. You're unique in your treatments and the cocktail of treatments you have for your MS as well. So understanding your own MS is really, really important. And we often speak to other people, but everybody's journey is very, very unique. And tracking the changes and what might bring these about is a key tool. And this can help you to identify trigger factors and patterns within your own journey. And just so you become aware of this allows you to plan and work your work or activities effectively around this, so you're not having MS controlling everything. You're still an individual who happens to have MS. So I just thought I would share with you, I don't know if all of you have seen these two booklets we have locally here. One is My Journey to Diagnosis, which is really quite a good way of logging your journey and keeping a log for yourself. So, because when you go away, especially to the mainland, to consultations, it's easy to forget when you're attending lots of different appointments. So this is a wee log that I've given to a few patients that I've seen prior to them having a diagnosis of MS. And on the inside, we have sections where I've sat with patients and planned what they want to achieve from their consultations and what they've found at their consultations as well. So these are booklets. Just wanted to make you all aware that they were there. And also My Patient Journey is a local booklet which is basically the same as what we've had with the My Journey to Diagnosis. But you have all your appointments, you have all your medication in it, you have the same plans for your consultations with your consultants when you go to the mainland. And it's just a wee journal. You can keep all your letters from your consultants, everything together, so you have that wee journal then when you go for your appointment. So anybody that doesn't have one and would like one, catch me at your next appointment or even email me and I can post one out to you. So it's really useful to log information about your relapses and keeping a diary. Using the patient journey or any of the apps that are online is really, really beneficial. Clinic Speak that Sharmeel spoke to us about with your 9-hole peg tests and your timed walks and things like that are really good to use as well. And their Clinic Speak is, Gavin will probably speak more about that. So you're going to speak about? Yeah. So I won't steal your thunder with that. So key to success in managing and living with a long-term condition is the right information at the right time in the right format, and that's got to be personalised for each individual, really. And you have the right to be involved in all these discussions. I think we work quite well together to come to these decisions. Good quality information is in a suitable format that's supported by guidance from health professionals has been shown to increase people's levels of confidence in the decisions they make and engaging with that process and reducing the anxiety and isolation of making these decisions, because there are a lot of decisions that you have to make around your treatments and things. I worked in other long-term conditions, and this is the first condition I've worked in where people actually choose the actual treatments they're going on, so it is a big ask for people to make these decisions. So I think the more information you have to make these decisions, you're able to make an informed choice. Florence is a system we've got locally here. It's a web-based clinical interface. Some of you are on it for your blood monitoring. We've put together some patient pathways for relapse as well. So this is going to be launched in the next month, where patients are going to get a text on a weekly basis. We did a consultation at an event we did last year, and it showed, I was concerned that people would find it quite intrusive, but the feedback was that people would quite happily have a text coming through every week. And you can see here from the actual pathway that you'll get a text through asking how your symptoms have been in the last 7 days, has there been any change, and it goes through to the end where you have either text your symptoms to myself or your GP, or if there's nothing, you'll get another text the next week. So it just means that can all be logged and printed off when you go to your consultant's appointment, if it's annual or 18 months, and you've got all that information there for you. So you've got these are the pathways we did for blood tests, because that was an issue that came through last year, especially when patients had gone on to Limtrada. Patients weren't complying with the blood test times, which I know myself is really easy to forget. A month comes around very, very quickly. The compliance has gone up to 100% since we started using the texting service for patients. And they just make their appointments when they get their text through, and I'm alerted if they don't, so it's quite a good safety net. I don't know if you've all heard of the Barts Blog. Has anybody been using that? So I've put all these links on for you with the actual link on them, so you can use them later when you get the slides. Barts Blog is really good. It's updated very regularly, and you get hot news off the press there. So they've been updating it all week since they came here. So Clinic Speak is another Barts research blog, and it's for people with MS. And the timed walk and the 9-hole peg test are two of the tests that you can do on this. So living well with MS, you need to ensure you remain as healthy as possible with MS, and this puts you in the best possible position to deal with the challenges that MS can bring. As we've said before, it's very unpredictable, and a healthy lifestyle can have a positive effect on how it impacts on your day-to-day life. Positive ways of staying healthy when living with MS include diet and exercise and not smoking. Sarah's going on to speak about this afterward. The barriers to self-management are often when people are diagnosed with MS, there's feelings of grief and loss that can be part of living with MS. And as different symptoms appear, that can raise its head again. So stress, depression and anxiety also reduce the ability to cope with MS and will therefore have an impact on successful self-management. And I think, we're all aware of these, and these are things that people don't see, hidden symptoms that can be quite difficult for people to live with as well. Over time, people may find their own ways to adapt, and that's what it's about. It's about you adapting around having MS in your life and not MS being your life. And there are some hints and tips there to give you for like giving yourself treats when things are difficult, that you've coped with stressful times, take up a new interest or hobby, not limiting what you're doing because of your MS. Take some regular exercise. Exercise has been evidence to show that it improves life for people with MS as well. Rest is not a failure. Resting is a coping strategy, and people, it's a strength to actually say and pace yourself regularly with exercise within your day. Take each day as it comes with this unpredictability. Try not to despair if you're having a really bad day. The chances are that tomorrow will be easier. And be honest and open about how you feel. If you go through a bad patch, talk to someone. And this is where events like this are really good, because you get to network with other people that are living with MS as well. And I think one of my patients said to me, it's like an exclusive club that nobody wants to join, but when you're in it, you're in it. So it's very much, that's so true. So be honest and open about how you feel. Try to unwind when you're stressed. Have a relaxing bath or go for a walk. Yoga, massage, and aromatherapy can be helpful as well. We don't have therapy centres here on the island, which people have access to on the mainland. And also making sure you're getting good sleep. We did the mindfulness course here, which was really successful for patients as well. And we gave our toolbox to the 20 people that attended that course with different strategies on dealing with anxiety and stress, which do have a big impact on living with MS. So overcoming the barriers, so developing your own self-help strategies with attending different meetings and different courses that we've run locally here on looking at, we've done fatigue management, your mindfulness, Tai Chi we did when we did the wellfulness, your breathing techniques and all different things like that. So, and also discussing your fears or distraction techniques. Some things to consider might be whether these symptoms may be side effects or any other medication that you're taking, and to be aware that alcohol can also create a low mood and make you more anxious as well. Socialising daily with family and friends, and doing something you enjoy, like going to watch a film, meeting friends, or going for a coffee or chat, which I know a lot of you do together. Cognitive behavioural therapy is also useful for depression and anxiety, and we access that through Revive in Glasgow. And O'Neill was asking if we do access a lot of the services through Revive for patients. So, and helpful tips for you. You've already given a lot of these, but the links are there for you as well when you get the slides. So for the MS Trust and the MS Society, a lot of you, we use these in clinic when you come into clinic, when you're looking for information as well. And Shift MS is another website that I've shared with you all as well. And that's my talk.